Hi all. So our report is all about your capillary puncture, arterial puncture, and your POCT, so your point of care testing.
The first topic is capillary blood collection, which is also known as skin puncture. Capillary blood is drawn from the capillary bed by means of puncturing the skin, for example, a finger or heel puncture. Capillaries are tiny blood vessels near the surface of the skin. Thus, capillary blood can be used for a variety of laboratory assays and often used for point-of-care testings and newborn screening. We use a lancet, which is a device used to prick a finger for a blood test. It is a small pointed knife with a length of 1.75 millimeters. The depth of incision for infants is less than 2.0 millimeters, and for the adults is less than 2.5 millimeters. The blood collection tube. We use capillary tubes with a blue ring which do not have an anticoagulant, while capillary tubes with a red ring contains the anticoagulant heparin which prevents blood from clotting. The preferred sites for puncture are the plantar surface of the big toe, lateral plantar heel surface of the newborn, palmar surfaces of the fingers, which are the third and fourth fingers, and lastly the earlobes, which is the least preferred site for puncture. Skin puncture is useful in adults with extreme obesity, severe burns, and thrombotic tendencies.
In performing capillary puncture, it can be done on lateral or medial plantar surface of the foot for the baby, and the best side for the adult for finger puncture is the third or fourth finger of the hand. The sides and the tip of the finger should be avoided. For the procedure, first select an appropriate puncture site. Next, warm the puncture site with a warm, moist towel no hotter than 42 degrees. Third, cleanse the puncture site with 70% alcohol. Allow to dry the area and do not touch the swab area with any non-sterile object. Fourth, make the puncture site with a sterile lancet or skin puncturing device using a single, deliberate motion nearly perpendicular to the skin surface or for the fingerprint. Fifth, discard the first spread by wiping it away with a sterile pad. Regulate further by gentle tap pressure. 6. Collect the specimen in suitable container by capillary action. 7. Apply and discard it properly in the lancet in the puncturing-proof container. 8. Label the specimen container with the date and time collection and the patient demographics. 9. Indicate in the report that the test result are from the skin puncture. And for order of draw of capillary specimen, first we have the blood gas, followed by the slide. Third, we have the EDTA or the purple tab. Next, the other additive mini container, and lastly, we have the serum or the red tab.
Arterial puncture is a common procedure to obtain arterial blood for gas analysis. The most frequently accessed arteries for these are the radial, brachial, and femoral arteries. First, the radial artery, located in the lateral aspect of the wrist, is often preferred due to its superficial location and ease of access. The patient's wrist should be slightly extended to palpate the artery and perform the puncture. Next, the brachial artery is found in the antecubital fossa, medial to the biceps tendon. This site is used when the radial artery is not suitable. Care must be taken to avoid the median nerve and brachial vein, which are in close proximity. Lastly, the femoral artery is located in the groin. It's used in emergency situations or where upper limbs arteries are not accessible. The puncture is performed with the leg in a slightly abducted position to better palpate the artery. Before performing a radial artery puncture, it's crucial to conduct the modified Allen's test to ensure adequate collateral circulation. These tests help determine whether the ulnar artery can provide sufficient blood flow to the hand in the event of ligation of the radial artery.
Now let's discuss arterial puncture procedure. So first we have phlebotomist preparation. In here the materials should be ready like syringes, needles, alcohol pads, and iodine, and many more. Next we have patient assessment. The phlebotomist should make sure that the patient is normal in terms of activity, respiration rate, and temperature, among others. Next we have preferred site. So radial artery is the best choice for arterial puncture. Now let's discuss modified Allen test. So a positive result indicates that the hand's color returns to normal after 5 seconds, and a negative result means that the color does not appear, so another site should be located. Next, in preparing the site, we use povidone iodine or chlorhexidine because the risk of infection is higher in arterial puncture. And when performing the puncture, the siren should be held like a dart in the dominant hand, and in the slide we can see the needle positions used for the arteries in arterial puncture. So after needle removal, the phlebotomist, not the patient, should apply pressure to the site for 3 to 5 minutes. And for the completion of the procedure, the phlebotomist should make sure that he or she checks the site for bleeding, labels the sample, checks for radial pulse, and applies pressure bandage.
Hello, hi y'all. Point of care testing, or POCT, refers to the medical diagnostic testing performed at or near the site of patient care, providing immediate results for timely decision making. It brings the lab testing to the location of the patient, made possible by development of small portable testing devices. It offers convenience to the patient and short turnaround time. It requires carrying out of quality control and maintenance procedures necessary to ensure that the results are accurate. Next is for the applications of the point of care testing. First is for glucose monitoring. POCT for glucose monitoring is essential for diabetic patients to manage their blood sugars effectively. We use a glucometer. A glucometer provides rapid feedback on blood glucose levels. It can be used at home, at work, or while traveling. Infectious disease diagnosis. We use your POCT devices or your testing kits for COVID-19 testing, for rapid strep tests, and your HIV testing. It enables prompt treatment and containment measures. It increases access to testing in various settings, such as your clinics or at homes, and it reduces the spread of infectious diseases through timely intervention. And lastly, we also use our POCTs in the ICU ward. I was going to say world of ICU, but we use it in our ICU ward. Such examples are your blood gas analyses or your portable blood gas analyzers, which measures the oxygen or the carbon dioxide and pH levels in the blood. It provides rapid results crucial for managing critically ill patients. It reduces the time required to obtain laboratory results. And lastly, it facilitates immediate treatment, adjustments, and interventions. Thank you. That's all for me. Thank you for watching. Thank you.